Okay, so the topic is post-term pregnancy. Post-term pregnancy means pregnancy greater than 42 weeks of gestation. So this condition is known as post-term pregnancy. It is prolonged pregnancy, previously known as post-term pregnancy. Now the post-term pregnancy is pregnancy which exceeds greater than 42 weeks, and that condition is known as post-term pregnancy. Etiological factors include idiopathic, it may be idiopathic, and there may be lack of normal high estrogen level, placental sulfatase deficiency, anencephaly can be there, or the fetal adrenal hypoplasia and absence of fetal pituitary gland can give rise to the post-term pregnancy. Now, most important risk factors are the previous post-term pregnancy and the post-term pregnancy. Babies develop, they are large in size, that's why known as macrosmia syndrome or the fetal macrosmia. It occurs when the placental function is maintained 80% of the cases. Previously provides nutrition and substance for gas exchange, result in the healthy but a large size baby with greater weight greater than 4 kilogram, and amniotic fluid is normal. Increase the risk of the c-section because baby are large in size and they can be arrested in labor. Obstructed labor can be developed. Shoulder dystocia occurs. It is the common risk factor for fetal hypoxia and brachial plexus injury for the fetal macrosmia or macrosmic syndrome. And another syndrome is dysmaturity syndrome. It occurs when the placenta of the baby is deteriorated, and placental insufficiency results in the reduction of the metabolic and respiratory support of the fetus, and amniotic fluid is decreased, which results into risk factor for the C-section, and oligohydramnios occurs. Umbilical cord compression also occurs in this condition, this maturity syndrome. Clinical feature of this syndrome is a confidential date should be uh, uh, reliable, and the patient is sure for the date. Menstruation cycle should be regular. Duration of the menstruations was usually for the patient, and the favorable cervix can be there dilated, a phased, soft, and anterior to the mid position can be there. So in this way, this condition is present, and the management is the induce labor, give IV oxytocin, and artificial rupture of membrane should be done. So this way baby can be managed as well as the life of mother can be saved. And to induce uh, artificial labor in order to give birth to the baby, because the baby is taken already time for the 42 weeks of the gestation, and baby has been large in size with polycythemia, and that baby is macrosmic, so that baby should be given birth immediately. So in this way we can manage the patient of post-term pregnancy.